Hello, this is Mariam Bari. I'm a current third-year medical student at Indiana University School of Medicine. In this presentation, I will discuss ultrasonography of the Achilles tendon. The objectives of this presentation include a brief review of the current literature, indications and protocols for an Achilles tendon scan, as well as some pathology. Ultrasound can be relied upon for detecting Achilles tendon abnormalities and determining severity. In one study comparing preoperative ultrasounds to surgical findings in 79 patients, ultrasound was highly reliable for verifying a complete Achilles tendon rupture. Only one false negative ultrasound examination was found in the 26 surgically verified cases. Additionally, 6 out of the 8 cases of bursitis were found, and there were no false positives. Lastly, there were no false positive ultrasound findings in patients with peritendinitis or tendinitis. In another study of 37 patients with surgically treated Achilles tendon disorders, preoperative ultrasounds were compared to surgical findings to investigate the reliability of ultrasonography as it related to the diagnosis of partial ruptures. This investigation found ultrasonography to be safe and reliable, with a sensitivity of 0.94, specificity of 1, and overall accuracy of 0.95. In addition to diagnosing injuries, ultrasound can be useful in predicting outcomes and monitoring progress. Ultrasound can be used to measure the severity of an injury and help assess whether surgical intervention is needed. Ultrasound can be an invaluable tool for physicians, as it's a quick bedside evaluation that's relatively inexpensive. Additionally, ultrasound is sensitive for pathology, and providers can discern between tendinitis, partial thickness tears, full thickness tears, bursitis, and other pathologies. However, there are some pitfalls with ultrasound. Anisotropy occurs when tissues show abnormal echogenicity, usually a loss of echogenicity due to an oblique angle of the probe. Tendons or ligaments may appear as hypoechoic and thus could be misinterpreted as tendinosis or as tears. To mimic this, rock your probe back and forth. Edge artifact occurs when a curved surface reflects the ultrasound beam away from the transducer. This appears as hypoechoic parallel lines projecting along the edges of the target. Edge artifact may make the curved Achilles tendon look like paratendon thickening. Providers should be mindful of these effects as they perform a scan in order to reduce the likelihood of a false positive reading. In order to perform an Achilles tendon ultrasound, you will need a linear ultrasound probe set to the musculoskeletal setting, as well as ultrasound gel. The patient should lay in a prone position with slight dorsiflexion of their foot. As you'll see shortly, having the patient's foot hang slightly off the edge of the bed allows for dorsiflexion. This makes the tendon taut and straight instead of curved, allowing for easier imaging. It should be noted that patients with Achilles tendon injuries will likely experience tenderness or pain. Liberal use of gel will allow you to minimize pressure while still obtaining a clear image. This should also aid in the patient's comfort. Obtain a long axis and short axis view of the tendon. To begin, we're going to have our patient lay in a prone position. We're going to place the probe on the patient's heel with the indicator pointed towards its head, and the heel end of the indicator will be on his heel where the calcaneus meets the Achilles tendon. I've placed the probe with the indicator towards the head, and here I can see the calcaneus, the Achilles tendon, as well as the retrocalcaneal bursa. I will then begin to move the probe upwards towards his head to scan the entire tendon. As I scan upwards towards the head, I'm appreciating the smooth cord-like fibers of the Achilles tendon. I'm noting any thickening or any changes in echogenicity, anything that might look abnormal. Here I can begin to see the gastrocnemius muscle. Here I can see the gastrocnemius and the soleus and the myotendinous junction. I'm going to rotate the probe 90 degrees to get a short axis view and then move back down towards the heel. Once again, I'm looking for any irregularities in the tendon. It can be useful to obtain a scan of the patient's unaffected side. This will serve as a control representing the patient's normal anatomy. Here's an example of tendinosis. We can see that the tendon is thickened beyond 1 centimeter, and the shape of the tendon is more curved. We can also see that this patient is receiving an injection. When we utilize Doppler flow, we can see that there's increased blood flow to this tendon. Usually, tendons are avascular. Now, let's take a look at an Achilles tendon rupture. This image is very different than our normal anatomy scan from earlier. Here we can see that the distal and proximal ends of the Achilles tendon are not meeting each other as they should. We've lost the normal architecture of the smooth cord-like fibers of the tendon. We can also see that this area is very thickened and that the tendon has pulled away from the underlying muscle. When we look at this in a still image, it's clear to see that the two ends are not meeting each other as they should, and that there is a lot of inflammation near the underlying muscle. Thanks for watching this video. If you'd like some additional reading, feel free to use these sources. An extra shout out to Dr. James Wilcox for providing all images of pathology.